So welcome everybody. I think we might start. We've got a few people joining us at the moment, so let's begin. So this evening we want to tell you about our Rouse development project, which is towards an innovative, far-reaching research-based solution for the local community. Before we begin though, I'd just like to make an acknowledgement to country. I'd like to acknowledge the traditional custodians of the land on which we're gathered and pay my respects to their elders, past, present and emerging. I'd like to extend that respect to all Aboriginal and Torres Strait Islander people that have joined us here today. So before I begin with the research, I'd first like to introduce Matt Sydenham, who's the Director of Redevelopment and Infrastructure at Western Sydney Local Health District. Over to you, Matt.
Thanks, Robin. Good evening, everyone. Thanks for joining us. So from my perspective, I'm just talking from Western Sydney Local Health District, and just as an overview, so Western Sydney Local Health District operates all of the health services within the local government areas of Western Sydney, and that includes the 5 major hospitals at Westmead, Blacktown, Mount Druitt, Auburn, and Cumberland. And it's exciting to be talking about a future health service at Rouse Hill. So in New South Wales, there's a process of facility planning that we're about to embark on, and we're looking at an innovative way of doing that. So as you may be aware, the new Rouse Hill site has already been confirmed at the corner of Commercial Road and Windsor Road. The site has been acquired by New South Wales Government, and that particular location's been chosen because of its good connections with the town centre, with with the transport links, including well, I normally would have said the new metro line, but it's been in place now for a little while, and this process that we're going through is based, and hospitals are based on clinical needs, and health informatics that's informed by census and emerging disease processes. But acknowledging that the Rouse Hill community of the future is emerging. It's not there now. So part of this process that we're talking about now is at its very early inception, and is around engagement with what we understand to be the emerging community of Rouse Hill and surrounding region. So the image you can see before you now, how to build a hospital, that's something that New South Wales Health have as a guide to explain the process of facility planning. We're right at the start of that. So what our colleagues at Macquarie Uni, or the Australian Institute of Healthcare Innovation, are going to talk about is an innovative piece to understand innovative ways of delivering models of care for what we understand to be the emerging disease burdens of the future in the Rouse Hill catchment area. It's to develop a paper later this year or into next year to inform what is called the clinical services plan for Rouse Hill, that defines the types of clinical services and the models of care and how those services can be delivered, with the intention of delivering them in a way that we understand the community would like to engage with those services. Obviously in 2020, with COVID, and certainly now, as we're meeting the challenge of now, that pandemic has forced the hand on considering innovative ways in delivering healthcare, not necessarily just in a face-to-face context as prior to 2020 all of us would be used to. So there's some overview here. So master planning is scheduled to commence early next year in its physical form, with construction due to commence about 2 years after that. 1 year after that, so in early 2023. So the intention of this reach into the community for engagement is to have various multiple opportunities to get involved. We want to hear what the community of Rouse Hill and beyond have to say, and how they'd like to be able to engage with this health service of the future. So thanks once again. So, and just on, here's a slide you'll see a few times. There's a QR code here that is intended to be accessible for staff and for the community. And by that we mean the public, but also providers of health services, existing health services in that community, to be able to have their say. So there's two parts to that. It's around this clinical service planning piece, or this piece that our partners at Macquarie Uni are leading, to inform the clinical services planning, but also into the very near future to be able to have their say about the construction piece, the built form piece. So the discussion tonight is about that paper that's going to inform the clinical service planning, and I look forward to strong engagement as we start talking about what that means in terms of a built form at that Rouse Hill site. So thanks very much, and I'll hand it back to Robin.
Okay, great. Thank you very much, Matt. So we're from the Australian Institute of Health Innovation, which is a research institute at Macquarie University. Our goal is to create high-impact health services and systems research that drives positive change in policy, practice and behaviour for the benefit of all. So from our institute, we have a project team that's involved with this project. The key project is led by Professor Jeffrey Braithwaite, who's the founding director of the Australian Institute of Health Innovation. The two lead researchers are myself, Robin Clay-Williams, and Associate Professor Peter Hibbert. And the two key researchers are Dr. Anne Carrigan and Dr. Natalie Roberts. We're supported by the research team from the Western Sydney Local Health District, led by Principal Investigator Catherine Maker and also Investigator Kristen Segaram. Back at our institute, we're also supported by an expert panel consisting of a number of professors and senior researchers. So today's presentation is going to introduce to you the research project that's going to collect information about the healthcare needs of you, the consumers, and you, the providers, who are going to be providing the care for the people in the Rouse Hill area. What we'll do is we'll explain how the research workshops will be run, and especially how you can be involved. And we want to listen to your questions about the research and try and answer as many as possible tonight. What we won't be talking about tonight is general issues about the hospital development. For those, there's information available via the link that's on the screen and also the QR code. And it's the same code that Matt put up about if you want to be involved in keeping up to date with what's happening with the hospital. So as we go through, if you've got any questions, just type them into the chat screen. You can access this at the bottom of your screen. And this presentation runs for about 5 minutes. After that, I'll stop and we'll be able to answer your questions. So research itself uses an evidence-based approach. So what do I mean by that? What I mean is we collect data or information about people and processes, and we analyse that information to determine outcomes or the best ways of doing things. So in the case of the Rouse Hill Hospital, we're going to collect information about the healthcare needs of the community. We're also going to collect information about the needs of the local healthcare providers. So whether that's general practitioners or allied health providers or alternative health providers, or the hospitals that provide care currently to the people in the Rouse Hill area. We're also going to harness innovation and technology and world's best practice healthcare models. And we do this from reviewing the evidence of what's happening both in Australia and overseas with new ways of delivering care. And from those two bits of information, we're going to develop solutions for a smart hospital for the future. So one that's very patient-centred and one that's very connected to your local community. So the way we do that is via a 3-step process. First of all, we collect data on world's best practice, and we've completed this bit already by doing a review of the scientific evidence. The second thing we do is we look at the characteristics of the community, and we do that through a demographic analysis. So that's very similar to the census that you would have completed a couple of weeks ago, where we collect lots of information about the community, you know, how old, what's the age distribution in the community, what's the sort of diseases that people suffer in the community and things like that. And we analyse that data to give us an idea of the characteristics. And then the third bit is we look at community and provider understandings and expectations, and we do that through workshops and focus groups and also through interviews. And that's the bit that we're going to talk about today. So the research focus for the groups is going to be on innovative models of care. And we've got 7 different models from the evidence that we're going to have a look at and see whether they're suitable for the people in Rouse Hill. The first one's ambulatory care. Ambulatory care is non-admitted services. So it's when you go into a health facility and are treated on the same day and go home at night. The second one is digital hospitals. And this is where we look at all the different ways that new technologies can improve care. Everything from computers to handheld devices to integrated Wi-Fi systems within the hospitals and health services. We're going to look at consumer-focused care. So special care models that focus on consumers and families and put them at the centre of their care, where they have more choice and can make more decisions about their care. We'll look at hospital in the home, so care delivered within your home so that you don't have to travel to a hospital or healthcare service. We'll look at integrated care. So lots of diseases or illnesses people can have multiple different healthcare professionals involved in their care. So we're going to look at models where that care can be better integrated. So instead of having to go to lots of different places for your care, you may be able to go to just one facility and they will look after all of the aspects of your care. We're going to consider the virtual hospital, and you would have run across this with COVID, where care is delivered either over the telephone or through a video system to you in your home. And the last one we're going to look at is specialist hospital services. So these are selective services targeted to specific conditions. So it might be, for example, something like diabetes, or might be something like kidney disease. So what we will do during the workshops and interviews is we want to find out about community and provider understandings of the healthcare and hospital system and your expectations. You know, what do you expect from your healthcare in Rouse Hill? We're conducting focus groups with community members, and we're conducting focus groups with the healthcare providers. We're also going to be doing some interviews with health service stakeholders. So these are people who are involved with the administrative aspects of providing care to the people in the Rouse Hill area. We'll also be conducting focus groups with those who have cultural and linguistic diversity. For those people, we'll have translated services, and it will occur a little later on in the year. At the moment, all the translators are taken up with supplying services for the COVID situation. And then later on in the year, we'll also be doing consultation with Aboriginal and Torres Strait Islander elders. So the workshops themselves, what are they all about? How do they work? Well, they're going to be delivered over Zoom, which is the platform that you're on tonight that you're looking at. Within each workshop, we're going to have 5 or 6 smaller focus groups, and there'll be 3 or 4 people in each of those groups. And it will all run simultaneously, where the focus groups will be in their own little breakout room. Each workshop is going to present different patient scenarios, and we're going to concentrate on 3 of the 7 models of care. So although there's 7 all up, because the workshops can only be 2 hours, because otherwise it's too long to sit in a group. We'll be looking at 3 different models of care for each workshop, but over the series of workshops, we will cover all 7 models. And in the workshops, we're going to be asking you questions. So the focus is going to be on you. So for an example, looking at a condition of renal disease and a model of care of hospital in the home, that might be one of the combinations we look at, but we've got many different permutations and combinations. And we're also asking general questions about care for people who may not necessarily have a disease at the moment, but may still need to access hospital services at some point. So it won't just be focused on particular conditions, but by focusing some of the workshop on conditions, we can do more of a deep dive and understand more about the needs of people in the community. So each of the focus groups will be recorded for data analysis. So we'll be stripping off the video. So on Zoom recordings, as you can see, there's a video feed. We won't be using that because we need to protect your identity. So we'll just be taking off the audio component of the feed. And when we transcribe that, we will remove any information that identifies you. So we won't be recording any names. We won't be recording any other things that you tell us about that might mean you can be identified. So all of the data, it's a way of protecting your privacy. So all of the data will be de-identified and it will remain confidential. And also our research has been approved by an ethics committee, the Western Sydney Local Health District Ethics Committee. So when we get the data, we do a thing called triangulation, which is a method of combining data to come to an outcome. So we're looking at the world's best practice, we're looking at the community characteristics, we're going to look at all the data we gather from you during these workshops, and then we will come up with a number of options or strategies for a hospital of the future. We give that information to health infrastructure and the local health district, and that will help them make decisions about how to implement care in Rouse Hill Hospital. So the next steps for you, if you'd like to participate in the workshop, and we hope that you would, is you'll need to complete a brief questionnaire to express your interest. So to do that, you'll need to access it via a computer or smartphone. And you'll fill out a questionnaire with some questions about your background and whether you're affected by any specific health issues or concerns. This is to just help us decide which groups to put you in or which workshops to put you in, so that you're in groups with people who have similar health issues that will make the discussion a little easier. So we're going to tailor the workshops to conditions relevant to the community, but we'll also have some general conditions we'll be looking at as well. So at the end of the questionnaire, we'll ask you if you're happy to be contacted, either by phone or by email, and then we can provide you the workshop details. So our workshops are starting straight away. We've got some provider workshops going this week, and we start the community ones next week. So please participate, and if you can get your questionnaire in soon. So to access the questionnaire, there's a QR code here, and there's also a link at the bottom.